For those of you who don't know about Nesta, we're an innovation organisation. We try and design and test solutions to society's biggest challenges. We've got 3 missions, and one of our missions is a healthy life. And what we do is a mixture of run experiments, build ventures, and also try and shape policy. And this is a topic that is getting increasingly high profile and attention. The Labour Health Mission had prevention right at the heart of it for 2 reasons. One, because it's a big way of actually improving health. If you actually want to improve the health of the country, prevention is the way you go. But also it's a way of reducing pressure on the NHS, particularly in the long term. So that's imperative, is why I think prevention is going to be very, very high on the agenda. Decades that prevention has been something that governments have talked about, and relatively little action has sometimes followed from it. So it's a question of what are the actual policy levers that are going to drive this. We also, I think, know that across smoking, alcohol, food, you can't do this just through government alone. It's actually about a partnership with businesses and others. So, for example, even in something like smoking, which has been driven heavily by bans and fiscal levers, it's also the fact that you've got substitutes from vapes and e-cigarettes that has allowed people to sort of switch their behaviour. So it's often a combination of product innovation and business activity as well as government activity. So we're going to have a good conversation. We're going to be joined also by Preet Gill, who is the Shadow Secretary of State for Primary Care and Public Health. She's going to come probably about halfway through the panel, and we're going to try and summarise all the great thoughts that you've got. We'll do a panel discussion, but we'll also have some questions from the audience, if that's okay. To kick off, I'm going to ask Hermione, who part of TBI has set out quite comprehensive approach to how you do prevention. So can you lay out maybe the problem and the overall argument we've got for the solution?
Sure, thank you. And thank you so much for having me. I'm sure everyone in the room is probably here because you know kind of the size of the problem, but I think it's worth just setting that out in a bit more detail. So the impact we talk about most is kind of on the NHS, I think. And data shows that obesity costs the NHS about 6 billion annually, and that's set to rise to 9.7 billion by 2050. But diet-related disease really relates to so many policy areas that I think any future government or current government should really care about. It limits children's ability to be productive at school. It's linked to poor productivity, both in work and people being out of work. 1 in 16 people are currently off work because of long-term sickness, which I think is a really stark figure. And I think it's interesting that we kind of had a bit more of an advanced debate around smoking recently, with Sunak's announcement at a Tory party conference and Shooting coming out and talking a bit more about vapes. But actually, diet-related ill health costs the NHS twice as much as smoking. So I think it's really good that we're having this discussion today. I think onto the kind of solutions. I think it's worth just noting or acknowledging that this is a really complex space. It's a really complex problem, and therefore there's going to be no silver bullet or single solution that we can lean on to address this problem. TBI published a report earlier this year as part of our Future of Britain programme, where we argue kind of a step change in the government's approach to obesity, which is classically kind of focused on personal responsibility and kind of policy solutions that focus on individuals taking more action and towards wider reform of the food environment. And obviously the food industry are kind of integral to that. So this is, a very important discussion. We in that report, we kind of set out 3 main areas of intervention. The first was to create a commercial food environment that provides accessible and affordable healthy options for people. And that obviously involves incentivizing industry, but also collaborating with industry, so that the kind of levers within that are things like legislation to restrict marketing of unhealthy products, and moving on this industry levy to incentivize reformulation. The second is to embed healthier food across all government entities, such as the NHS and schools. So things like rules for government procurement, so taxpayers' money spent on healthy food. And then the final bucket is to actively adopt new research and technologies and treatments to improve the prevention and treatment of obesity. So yeah, that's what we set out. We can maybe get into some more detail on those later on.
Right. There you go. So as we have a mission which is to try to halve obesity. Now that sounds ludicrously ambitious. It would involve getting obesity levels back down to the levels they were in the early 1990s. Can you just say a little bit about why you think it's actually a smaller change than people might realise, and more achievable?
Sure. Yeah. So it sounds huge, doesn't it? It's costing the NHS almost $6 billion a year, and the total value is much larger than that. That's direct costs. So the total value is around 54 billion a year in sort of ill health to the nation. And so, what if I was to tell you that all it would take to substantially reduce that is 216 calories per person per day? So this is for individuals living with excess weight, so living with overweight or obesity. And 216 calories, for people who aren't familiar with that, it's about the size of a bottle of Coke. So it's small. To put it in percentage terms, it's about 8.5%. Now, two things normally happen when I say this. People say, we shouldn't be counting calories, and that's not the individual behavior change isn't the way to do things. And that is absolutely right. So we at Nesta are counting these calories from a population level approach. That's the change that you need to see in products sold and consumed across the population. That is not saying if only you paid more attention and did something different. So that's really key. And why this works, sort of the change here, is because weight change happens very slowly over time. So you actually only need a small change to change the equilibrium point, and then it might take 18 months, 2 years for someone to reach this new equilibrium point. And the kind of beauty of this is that you can have these improvements without any difficulty for the individual. So it's essentially the opposite of diet culture, right? I say diet and people think about huge transformational weight loss, people losing 20, 30 kilos, making these huge lifestyle changes that are in no way sustainable. And then for people who may have been on diets, including myself, you go back to your old ways of doing things, and because it's hard, the diet's difficult. And so what we're talking about here is many, many imperceivably small changes to people's diets, which are driven by changes to the food environment, that all add up to this 216 calories, that don't require any individual effort, so will be sustained in the long term. And that's why we think this is achievable. And really importantly, we think this is achievable without taking away the joy from food. So food isn't like smoking, right? We need to eat. And so that's, there's a role for industry partnership here. The changes that we're needing to see is not that big. And it doesn't mean, there'll be no crisps for anyone. It'll just be carrots and water.
So we'll get into, okay, how do you actually drive that in a second? But I just want to hear from the other panelists first as well. Chris, I mean, you're the Chief Commercial Officer. Mm-hmm. So I think it's fascinating that you're on this panel in particular, because you can speak, what are the commercial imperatives towards a more healthy portfolio? So what's ASDA's sort of commercial interest in health?
Well, look, firstly, delighted to be here, on a Monday, talking this through with everyone here. And I think this is why we're really pleased and proud by the partnership that we're going to striking up with Nesta. Because actually, at ASDA, as all the retailers, actually, we all feel that we've got a big responsibility. To help customers, colleagues, communities lead healthier lives. A lot of when we do all of our customer research, customers do say it. They do, and I think Hermione was spot on there, right? There's a lot of barriers that customers come up to it, whether it's in motivation, cost, time, things like that. So to work with them to unpick some of these things is, I think, really, really important. Our aim is just to make it easy, really, easier for shoppers by offering them quality food, because you're right, you can't compromise on taste for that. So the quality and the nature of the food, but have healthy food at more accessible prices, really critical, because of clearly we're really conscious of the cost of living crisis, and then some of the barriers that we find in there. Retailers, and certainly speaking for ASDA, and you are right, I look after the food division, which is the total food division within ASDA. We stand ready. We're here to work with government. We're ready to work with policy. We've got the same shared ambition, and therefore, absolutely, how do we want to take this forward is really critical to us.
Great. And Sophie, obviously, you work with investors, and investors engage with businesses like ASDA. how are you seeing health rise up the agenda in terms of what investors are thinking about?
Yeah, so it's massively rising up the investor agenda. So I'll come back to kind of the case for it, but just briefly. So in response to the National Food Strategy in 2020, I set up the Investor Coalition on Food Policy, and over the last few years, that's grown to a coalition of over 30 investors representing over 6 trillion in assets under management. And really why investors are concentrating on this issue is they see the long-term risks that are there now and that are quite material to financial value. So when we think about this, and actually the reason we care about those long-term risks is really as investors, we are investing on behalf of our clients and beneficiaries. And it's really important that we are investing in businesses that are resilient in the face of some of these big long-term challenges. So when we think about the kind of that sort of case, if you like, we think about it as kind of the risks, the opportunities, and then absolutely also the moral and social imperative to act. And we've already outlined that problem. So on the risk side, there's the direct risk of regulation. Increasingly as well, there's reputation risk if companies aren't taking the right step. But I think really importantly, when we look at this issue, it's the systemic risk. It's that indirect risk. Hermione's already laid out, the impact of diet-related health on workforce productivity, workforce well-being. That has an impact on all businesses in all industries. And if we don't tackle that, a lot of those people are in the working age population. So we're really starting to see that. And this is also only one of many risks facing the kind of food system. So when we think about it, we think about healthy, affordable and sustainable food system. And really that's why it's rising up the agenda. And I'll come back in maybe a bit later in the discussion to sort of talk about what we're calling for. But as investors, to be able to understand these risks, we need companies to be reporting data to us that helps us understand them. And at the moment, for something like health, we're looking at very inconsistent data across the companies we invest in. And that makes it really challenging for an investor to understand the risk that is sitting in their portfolio. So that's a little bit about how we think about it.
Right. So I want to get into some more detail about the specifics of how you do prevention and what policies will drive it. But before we do that, the title of this session sort of assumes that prevention is better than cure. Obviously, we've seen a lot of new drugs arrival, particularly to tackle obesity. What's the case for actually going hard on the curative side and pushing hard on obesity drugs as opposed to trying to do prevention? Is there not a case for that? Hermione, do you want to pick that up?
I think that we're going to need both. I think this is such a huge problem and is only going to continue to be, a problem unless we really get to grips with it and tackle it. So we need to, we set out in our report that we need to focus a lot on kind of primary prevention. We need to prevent the actual causes of obesity. That's particularly important for children, and we need to target a lot of these interventions, prioritize children with those interventions. But I think also governments do need these drugs. They're going to exist. They already exist, and governments are going to need a proper strategy for them to make sure that those that need them most can have access to them, but they're not just a and it's not an excuse not to intervene more broadly in the system.
Hugo, if you look at the numbers here, you've got about 2/3 of the population are overweight, a third are obese. How big a role do you think obesity drugs can actually play in curing this versus how much we need to do through prevention, if you like?
Yeah, so as sort of mentioned before, these drugs are a good thing, right? So we shouldn't have to frame this like prevention versus treatment, but they are limited in their impact in two major ways. One, people tend to regain the weight after they come off the drugs, and that is largely a result of a food environment that makes it very, very easy to overeat. So if we can improve the food environment, you've also improved the efficacy of these drugs long term. But the reason why it matters that you can't just have people on this, wouldn't want to have people on these drugs forever, it's very expensive at the moment. And so, if you were looking to halve obesity with these sorts of drugs, it would cost you almost 13 billion a year, right? So these are big numbers, right? And that's not money that we have readily available to spend currently. And so these drugs are a good thing for a decent number of people, but we're talking more in the 5%, not the 50% of the population here. And I think people would generally agree it would be quite a sorry state of affairs if we ended up having to drug half our population in order to get around the food environment that we've kind of created for ourselves.
Great. Okay, and let's talk about prevention policies then. And what policies for prevention are consistent with two things? One, a partnership with business, because we've got to do it with business, but also one that doesn't hit cost of living concerns. Because the obvious policy proposal that's been put forward before with things like sugar taxes, salt taxes, that is going to be very, very difficult in the current context. Are there policies that will have the same kind of strength of effect as those, but without the kind of political challenge? And Hermione, what have you looked at? And what's your proposal?
Yeah, I think one of the questions that you kind of posed in advance was what are the issues that both industry and government need to be kind of collaborating to solve? And I think the cost of living crisis is absolutely currently at the top of everyone's, certainly governments and the opposition's agenda. I think TBI has a Future of Britain programme, which I think I mentioned briefly earlier, which is kind of looking at solutions to some of our biggest challenges. And we're kind of in this situation where basically people are paying higher taxes for less effective public services, and obviously nowhere is this more evident than the NHS. So the choice is either we get this under control, we overwhelm the NHS, which we're just not going to do, or we cut other public services to pay for it. So I think we need to look at policies in that context. I think, we support. I think the other thing that we need to say, given that this is such a cost to the state, I think we need to support policies that we know do work and build on those. And we do support an extension of the soft drinks industry levy. There's been a really great campaign called Recipe for Change, recently led by Obesity Health Alliance, which calls for kind of an extension of fiscal levers. And importantly, any revenue that is raised, they call to be invested in measures that can improve children's health. And I think we need to separate really supporting those that struggling, those least well off in society, and also I think we support further measures like that.
Great. Hugo, do you want to take another go?
Sure. So as an extension of the sugar, the SIDL or the salt and sugar tax as put forward in the National Food Strategy, that would work for health, right? So we're not saying that wouldn't have positive benefits, but if the question is, what can we do that has no meaningful impact on costs? If we're saying that we need to have that as part of the policy, we think there's something that actually works really well in tandem with this, or in addition to, which is what we're calling mandatory targets for retailers. And so what this would look like is you set a target about the healthfulness of what is sold at a retailer level, and you strongly incentivize that. So in this case, there'll be financial penalties if you didn't hit it. And what you do, and so then you're incentivizing the outcome, right? Everyone agrees that we need upstream interventions. It shouldn't be at the individual level. And now we're saying we don't want cost involved in it. So what can you do there? Well, the change that's required, as we said before, isn't that large. So a number of retailers are actually doing pretty well currently on something called a nutrient profile model score. So it's a measure of healthfulness of food that's sold. And so if everyone got up to the performance of the best currently, you could have a huge impact on the nation's health. So rough values here, talking about 10 billion value a year, about 1.2 billion saving to the NHS. These sort of targets were met. In calorie terms, in obesity, it'd be about 80 calories. The interesting thing about this, of why it would not necessarily lead to cost changes, is twofold. One, how stringent these targets are. As I say, lots of people are doing pretty well against them at the moment. So you're not talking about a giant step change from where current practice is. And two, how long you give people to hit these targets. So we're talking about maximizing the number of levers a business could have. So they might not just reformulate their products. They might change the portion size. They might change the placement, the advertising, the marketing, the whole sort of gamut that goes around it. We don't know the best way to sell food to people. The industry does. What we care about is the health outcomes. And so, if you were to put some these sort of mandatory targets in that would need to be underpinned by data, as Sophie mentioned, you could give people, let's say, 5 years and before the targets actually came into play. in terms of before the penalties came into play, in order to hit these targets. And during those years, you would already be reformulating your food, changing your store layout. So it wouldn't be tomorrow you have to hire 1,000 new nutritionists to hit these targets. It'd be using the processes that businesses already have and just putting a slight change into the incentive structure in order to prioritize health. And the inspiration from this actually comes from a lot of the work on the sugar tax, right? Where the benefit was people not paying the tax. We don't want anyone to have to face these penalties. The idea is you set something that's an achievable goal, that's actually a reasonably small change that makes a big difference to population health, in order to sort of bring in the externalities into the equation.
Okay, well, let's get some reactions to that from around the panel. Chris, I mean, normally when you speak to industry, I used to work quite a lot in climate change, and usually the first response was, well, we don't really like regulation. The second response was, if you really want to do it, make sure it's long-term, creates level playing field, doesn't micromanage.
Yeah.
In your reflection on the viability, desirability of what Hugo was saying.
Look, if I speak on behalf of all retail for where it is, right, and so my 20 years working within retail in the UK, gosh, and internationally, I think what we like about it and what we can see work is actually how do you get government and setting a policy and setting a mission and an ambition, right? I think that's really, really clear for us. It puts us as a retailer and an retail industry on the right consistent approach and for our mutual desired outcome. So I think that's really clear, and that's what I think comes across really well. The methodology, how we would like to deliver that, though, I think requires each individual retailer to be flexible in terms of their respective approach to do that. And therefore, the engagement with retailers at the start of the process is very helpful, because you have to work that through for the different nuances of your business, how you all are. I think the approach and the policy and certainly the conversations I've had with Nesta and a multitude of different things across the sector, is it can't just be about own brand food as well. It has to be branded. So I think the balance of those two respective products works really well, because we sell them in they coexist. They're not mutually exclusive, certainly. And therefore, it means that all the conversations that we can have with our supply base, whether it's branded suppliers or our own label suppliers, in terms of reformulation or in terms of where do we want to take this forward, is really clear. The truth is, the food industry is already progressing. It wants to go down this. We've said from before, we always follow the customer. Every retailer that I've ever worked with will always say that, and therefore, actually, if customers want to go down that route, which they clearly do, given all the customer research that we've seen, therefore all industry and all food industry does actually go down the route to how do you promote healthier choices. So that's where I like it. I like the approach, and I like the thinking that's gone into it, and this, proportionate, pragmatic, evidence-based policy. Why wouldn't we all concur with that?
Sophie, what's your take on this, and also how the investors would respond to it?
Yeah, I mean, I think there's really strong alignment between the kind of Nesta proposal and what we've been calling for through the coalition's work. I think one thing to bring into the conversation is as Hugo mentioned, underlying data needs to be consistent that goes into this particular approach. And in response to National Food Strategy, the government set up the Food Data Transparency Partnership. It's a bit of a mouthful, but that is an active open policy design process that's been going on. We've been feeding into it as investors, but also industry have, academics, NGOs. And I think that has the real potential as we go into the next couple of years to collectively build the underlying data set to be able to support something like this. So we would massively support it. And I think, the mandatory reporting, I just want to spend a moment on that as to why that's so important, because we've had, voluntary reporting frameworks. We've got a lot of different ones across lots of different issues. And actually companies tell us that they feel overwhelmed by how many there are. And I think it's really important for us to be able to collectively agree, on a few kind of quality metrics that we look at across health. and that will really, we believe, save time over time, because actually you'll be aligning to a methodology that is accepted, that's government endorsed. And just to kind of show you the scale of challenge there, a lot of the retailers, and I'm sure Chris will agree with this, working internationally as well, are having to not only align to what's in the UK, but there's actually 78 government-endorsed nutrient profiling models out there. So if you're a retailer that's got exposure kind of globally, what do you decide to kind of, put your flag to? So it's great that we're talking about the UK, but we also need to think about that kind of global context, and really think about this, as sort of bigger and with that kind of global perspective, as well as just thinking about it in the UK. I think that's, but broadly, really, really supportive, and we're looking forward to kind of working with the coalition and Nesta on kind of this process.
Right.
Yeah, thank you. I think there are a few things that came out of that. We also are broadly supportive. I think Hugo mentioned that this is something that can be introduced alongside other policies, and we said at the beginning that this isn't a silver bullet. We're going to need to do a lot of things at once to address this problem. So I think that's really important. Also, Ravi, you touched on climate, and I also do some work in climate. And I think what's really important is that we have consistency in policy, and you give businesses kind of the time to plan, and it's set out in a way that they know that you're going to stick with this. We've got a clear target and kind of a clear plan. And then I'd also just echo Sophie's point about the importance of these things being mandatory. We've had kind of both voluntary reformulation programs, and we've had voluntary reporting for a long time, and it just hasn't worked. So I think we are at the stage where we've got to get seriously focused on things that are more likely to work.
And just to sort of follow up, we focus a lot on retailers, understandably so, because they have quite a lot of influence, including over what is manufactured. But is there a case as well for, firstly, some direct incentive regulations on the manufacturers of food, but also the out-of-home sector, so restaurants, delivery platforms, which obviously has grown and changed quite a lot in the last 10 years, and maybe perhaps a bigger part of the reason why obesity has doubled in the last 30 years. Does anyone want to come in on that?
I'm happy to start. Yeah, I mean, I think absolutely it's so important. I think we've had that slight challenge, and I know through the Food Data Transparency Partnership there's been that discussion about maybe it does need a slightly different approach given the different nature of those businesses. But we've got to be able to think about this across the whole kind of food system, not just retailers. Obviously, they have a more direct line with the consumer, but we need to be thinking about manufacturers and out of home absolutely as part of it.
Great, thank you. I'm going to throw it open to questions from the floor. In just 1 second. So I'll ask Chris, in terms of what you see internationally as well, obviously global footprint. Are there any particular countries you think we can take any inspiration from or learning from, either from what retailers themselves are doing or the sort of policy framework we can borrow from?
So in terms of countries where I've worked, so I looked after food across Central Europe, and had the pleasure of being based in Bangkok for 3 years over there. The truth is, some of the countries that I've worked in probably has slightly more fundamental challenges, right? Whether it's around the cost and accessibility to food, right? So if you start looking at that piece, because no overriding in terms of feeding families or feeding your kids would always take precedent, clearly, right? We're seeing some of that challenge clearly in terms of the UK, as we've had a couple of years of quite quite extensive inflation, and therefore the cost of food that's out there. So therefore that's why policy, which has just driven up inefficiency and led to retailers and suppliers spending money that could have been better served in terms of the costs and the prices that we charge onto customers, probably isn't particularly helpful at this time. Genuinely, I think the UK market, out of all the markets I've had the pleasure of working in, is the most competitive. It certainly is the most transparent, and therefore, when customers clearly speak around their desires to make healthy choices as much as they do. And they speak to us in terms of all of our research groups about how they find some of the barriers to do that. All retailers will hear that in a similar vein and want to step forward. So actually, I would use that as the catalyst to accelerate the pace of change.
Right, thank you. Does anyone else want to propose the country that they most want to borrow food policy from?
There is a great example.
Okay.
Actually, it's not country; it's a city. But Amsterdam is a nice example, I think. From we haven't necessarily used the word systems perspective, but I think it's so important. You think about the whole system when you look at how to improve health. And what they did is they actually, I can't remember the exact stats, I think it's reduced childhood obesity by something like 30% over sort of 5 to 10 years by using a range of different measures. So there was some on the marketing and advertising side. So advertising of unhealthy food was banned at sports venues in the city. There was also just water allowed in schools, so that had a big impact. And then there was the educational impact. So there was a mixture of different kind of tactics used by the government, and I think that's a really interesting one. But it also raises an interesting question because there's a big cultural kind of component to how we sort of see food and health in the different places. But yeah, that's my little example.
Money.
I think it's somewhat depressing that there is no country that has successfully reversed obesity. Some countries have been better than others at stopping, sort of preventing the rise, but no country has successfully. I mean, there are lots of interesting policies coming out in South America, potentially specifically on ultra-processed foods and things like that. But I think it's kind of too early to really see what the actual impact is. I think just that also raises the point that data is so important for us to collect as much data as possible to really understand what policies are working where and what policies aren't, because it is such a complex area that we need, data from industry, data from government, and that's why I think the work that Sophie's been involved in is really important.
Yeah, that data thing is probably not as well known outside of the.
It's not that sexy, really, is it?
One interesting feature is, I think Hugo, you can speak to this, is that some years ago it was assumed by policymakers that obesity was getting better because some of the surveys that were being done about people's sort of diets, actually, that turned out to be totally wrong. It's only then that people woke up to the fact that actually this is a bigger problem than people realise. But do you want to say something?
Yeah, that's correct. That's why objective data is so important here. If you can think about it yourselves. If you try and remember what you ate all of last week, you probably missed some stuff out. You probably don't forget the broccoli. You probably do forget the biscuits. And so these sort of self-report data is off by 30 to 50%. It's huge. And so that's why this data is now captured for what's sold. Right? Retailers know what they're selling. They use that data for the business. And so if we can use that to design better health policies, that feels like a big win-win.
Great. Welcome, Chris.
Hello.
We've just been discussing how we tackle obesity in particular. I want to give you the chance to potentially sort of say a few words, and then we'll go to the audience for some questions for that.
Brilliant, thanks so much. And it's so good to be here. I'm Precool Gill. I'm Labour Shadow Minister for Public Health and Primary Care. This was actually my first portfolio as a council cabinet member when I was a councillor in Sandwell. So as you can imagine, I'm really delighted to come full circle to be doing this brief right now. I think then as now we face a national epidemic of obesity, which has only gotten worse over the past 13 years. And when it comes to public health, let's just be blunt, there is really a clear divide between us and the Conservatives. And while the Tories want to leave something like the obesity epidemic to the individual and untrammeled market forces, we believe in active mission-based government that brings together communities, industry and government to drive change on the national challenges that are holding our country back. And the obesity epidemic is a real problem. Today, 2 in every 5 children in England are overweight or obese by the time that they finish primary school. And by 2050, obesity is projected to cost the NHS nearly £10 billion a year. And we lose tens of millions of sick days to obesity every year. It is a social justice issue too. So children from deprived groups are more than twice as likely to be obese than their better off peers. And meanwhile, the health risks like diabetes are shared unevenly across society. I'm thinking here about the risk of diabetes in the South Asian community, but of course in my own family too. Labour has already set out a national mission to build an NHS fit for the future, and an integral part of that will be reducing health inequalities and shifting the balance between treating avoidable disease to a prevention-first approach. I know this is what the sector is crying out for, and I know that is the right thing to do for the country, long-term solutions over sticking plaster politics. And for 30 years, there's been no joined-up plan for health. There's been an unwillingness really to lead on issues like childhood obesity, and services and institutions that promote good health have actually been run down. And the government abolished Public Health England, a body that was renowned for its research and expertise with no strategic replacement. And we know that our health mission is not going to be achieved by one department, the Department of Health, working on it. It will require cross-Whitehall, joined-up government and a proper partnership with local communities and industry. And the causes of obesity we know are complex, they're multifaceted, so we are clear we need a holistic response if we're really going to make a dent in this issue. And industry has a big role to play in this. I know that most businesses actually want to do the right thing, but if they're undermined by competitors doing the wrong thing, then you manufacture a race to the bottom. And for government, then it's about putting the right incentives in place, opening up that dialogue and giving clarity about the direction of travel and timescales. That's really what I want to do today. So to be frank, the government's promises have actually fallen far short of the mark. They've dragged their feet on banning junk food advertising to children, refusing to publish the technical consultation, never mind lay the secondary legislation they promised. And meanwhile, industry is in limbo and children are being targeted with things like Kit Kat cereal. And Labour has been calling for this ban for years, actually. We know it works. Question is, why aren't they getting on with it? We'll take the National Food Strategy, which had virtually nothing to say on health, despite Henry Dimbleby's efforts. The one proposal that it has taken forward on food data transparency has actually been watered down and ground to a standstill. So it's really impossible for businesses to know where they stand with this government, which constantly chops, changes and sends mixed messages. The net zero, HS2, I could go on. But we've been really clear. Those who profit from harming our children, we say no, not in Britain. So Labour will ensure that every child gets a healthy start in life, and we take action on childhood obesity. We've already set out a children's health plan, as you know, with every child benefits from a board education around physical activity, introduction of free breakfast clubs for every primary age child. And our plan to train, of course, 5,000 more health visitors is really going to be important in terms of targeting early years, supporting parents to think about actually, how they support their children to have the best start in life. And at the centre of it all, we will establish a health mission delivery board to bring together all departments with an influence over the social determinants of health, a mission accountability body akin to the Climate Change Committee to drive progress our society needs, not just within the NHS. So we know business as usual is not going to cut this, and that to meet our missions to cut deaths from cancer, cardiovascular disease, we will need to address the obesity epidemic and the role of food. I'll leave it there. Thank you.
Thank you very much. That was a lot in there. I'm going to throw open to the questions now. We can take sort of three in a row, and then we'll get some responses. Okay.
Come to the back first.
Back first, and then we'll gradually make those.
Hi, is it on? Yeah. Hi there. Thank you. I'm Cherry Parker from Saffron Walden. So, question for the panel: what are the concrete steps that a Labour government needs to take to make this a reality, and how soon could it be realistically switched on? And then a question to Preet: Public Health England has gone. Are we going to bring it back?
Stay one more.
Oh, great. Hi, I'm Natalia from Custom Clay. My question is, how do you bring in big businesses and corporations whose business strategy is essentially based on high calorie, low nutrition value products? How do you hold them accountable? And the second part of this question is, how do you also prevent them from going into markets and global south and raising obesity levels there?
As everyone's done two questions, I think we should stop there and just throw it over quickly. I mean, on the sort of question of concrete steps, in some ways, I think you've all kind of covered that a little bit, but do you want to just say from day one, what would you prioritise? If there's one thing you prioritise, and how quickly could it be brought in? Let's go with that. Yeah.
Yeah, I think what Preet was just mentioning around, the NFS, the National Food Strategy recommendations, get them back on the table, include health, and sort of reignite the ambition that the Food Data Transparency Partnership had in its early days. That would be my first one.
I was a bit of a comment. I feel that the National Food Strategy is an absolutely brilliant document that we really support, and a lot of it has not really been taken up, which is a huge waste. So I think revisiting those recommendations, considering the current conditions like the cost of living crisis. I also would just say isn't so much on delivery, but don't be afraid to be bold, because all the evidence shows that the public are really up for much more action in this area. They really support it. There's been some so much more polling coming out on this, and I think Labour should, take that board.
Hugo?
Yeah, I mean, Preet sort of said it. Day one, do the stuff that works, right? Where there are big impact assessments about how these policies would work in detail. You can just press go on them. In terms of the junk food advertising ban, for example, and on this mandatory data, we know exactly the data that we need for this, and we know businesses have the data, so we can just say, no, from the get-go, we need this reported immediately. And then that data will allow you to set other targets or things, but that's the bedrock. Step one, day one, do the stuff that works, mandatory data.
Yeah, no, I listen. I can echo that. I can hear it. Right, government set the mission, put the industry on the path, and then let businesses sort through the flexibility and the methodology to go and achieve that one. Completely concur.
Great. Preet, on Public Health England, what you can do on that? I'll add one more to that, which is you sort of briefly mentioned a health body akin to the Climate Change Committee. So I was involved in setting up the CCC. So I'm intrigued by what you have in mind.
So look, this isn't just about the health department. This is about looking at so many social determinants of poor ill health in this country. And, there's so much more that we need to do around prevention. So this cross-government approach is really about driving every government department to think about actually how their policies impact the wider issue around this, or whether it's planning, because we see, fast food chains opening up on our high streets, for example, targeting so many of our young people. But of course, we've got to think about the evidence, the research. There is so much already out there that we should be absolutely just taking and implementing. And I think it was just tragic that the government got rid of Public Health England. Certainly when I was a cabinet member, I relied on them massively in terms of programs that we need to do. But we've got to have an approach which is local, regional and national. It isn't just about the policy shift from government. Of course, that's very, very important. Legislation banning junk food, all of that is good. But actually, we've got to make sure it's driven all the way down to our regional bodies working much more connectively together. And we know young people are on social media ads, right? I would love to see an ad, for example, that tells me if I eat this burger, how much exercise I'm going to have to do in order to be able to burn that off. That's the kind of positive impacts that actually, as opposed to say this has got this much sugar or fat content, actually, what does it mean and how does it impact my life? I think those are the kind of ads that really make people think and think, oh my God, I'm going to have to do X amount of exercise, because we're not a physically active population anyway, and this is half the problem, isn't it? So how do we get more people to think about, being active, what they consume and what they put in their bodies?
Great. So there's a question about how you sort of bring in big business and shift their behaviour, because obviously there are companies that are making a lot of money out of certain types of food, and how do you shift that? In some ways, what Hugo's proposing around targets is about driving reformulation and driving a shift in the recipes. It's not about taking them completely outside of a certain business segment, but it's about making everything a little bit better, which we think if you're talking about trying to get a 8.5% reduction in calories is what you need, rather than wholesale shifts in food categories. But I'm interested in well, Chris, perhaps you can come in on this in terms of when you're obviously relating to the other manufacturers, what shifts their behaviour?
We spend quite an extensive amount of time, as you can probably appreciate, working with our 2,000 suppliers, and they're everything from small suppliers right the way through to big global brands. We spend a lot of time with them talking through, in terms of the responsibility that we have as a retailer, the responsibility they have in terms of dealing with the obesity crisis, the challenges that is. But it's always led through the similar desire from where consumers are coming from. So therefore, actually, the similar desire from the consumers that actually they want to lead healthier lives, but actually facing into some of the barriers that they have. Right. So therefore, whether those barriers are cost, time, access to it, education, understanding, therefore, actually, what can we be doing? I think the approach there through Hugo's talking about, which is why we're delighted to spend time working that through, is okay, what can we therefore do whether it is. Not all products are equal, so therefore how do you categorize them all, and which ones can we reduce sugar down, which ones can you add more fiber into, which ones can you have in a different way, because actually by doing that can make a seismic difference.
Great, thank you.
Let's just briefly
Yeah.
add there as well, just to come back to kind of, I think it's a really interesting point, because it's why we really need that well-designed regulation that creates the level playing field. And actually, it's not just about the leaders, and we've been talking to some of those, and they've been calling out for that level playing field, because there's only so far they can go on their own. So I think that mandatory framework would create then more transparency, and then with that transparency, both consumers and investors and their other stakeholders in that business can put more pressure. So, for example, just from our side, we've seen this with climate change. Shareholder pressure can be really powerful, whether it's voting at a company's annual general meeting, engaging with those companies, but also there's the public pressure that comes with that greater transparency around what the companies are doing.
Thanks. Right, let's take lady beginning there, and then gentleman there, and then.
Hi, thanks for all of your contributions. I'm Clara Oakley, Head of Policy at the Vegan Society. And my question is, given what we know about the health benefits of whole foods, plant-based diets, is it time for health institutions to be actively promoting them as a preventative method? And obviously, kind of when I've asked this question before at Conservative Party conference, I was told that the Conservatives don't want to tell people what to eat. So would you agree with that approach? That's my question.
We've talked about obesity today, but this is the other side.
Yeah.
Hello. I've got loud voice. Look, the other side of the coin is malnutrition. So I come from a group of residents in East Brighton that was originally funded by Nesta program, Social Movements for Health. And out of that, the East Brighton Food Cart was born. We set up a community meals and meal service during lockdown. And obesity cost the NHS $6 billion a year. Malnutrition costs the NHS in England $21 billion a year, just in England alone. And the cost of malnutrition on adult social care and hospitals is 4 times more money to treat a malnourished patient than it is a normal patient. Saying that prevention is better than the cure, is there a case for community meals and wills to be made statutory due to the fact that a meal a day will prevent malnutrition and save the NHS billions and billions per year just for the price of a simple community meal? Just like you don't let children drink alcohol, take drugs and smoke cigarettes, surely local authorities should be given the regulations to enable them to provide a community meals and meal service. And there's already a system in place to actually pay local authorities through the Household Support Fund. They could actually ring fence this money for local authorities to spend in the local community according to their local provisions. But prevention is better than the cure. There's 1 million pensioners in this country who are suffering from malnutrition as we speak. A simple community meals and meal service would tick every single box and save 20 billion a year. So is there a case for making meals and wills, community meals and wills, statutory? That one's really for free. Thank you. Oh, sorry.
Was it me or you?
Lady there.
Yeah. Thanks very much. My name is Patty Randall from Baby Milk Action, International Baby Food Action Network. So I work a lot in the global field where most of the big corporations are active, either in Codex on the trading standards or at the World Health Assembly or wherever, and human rights. So over the years, we've seen, how governments make all these promises. But since, I'd say, 2002, it got really worse in 2011, when the multi-stakeholder approach really took over, where everybody was required and pressured to be in partnership. And in a way, your panel is a little bit accepting that that's the way we should do it. Whereas from our perspective, looking at the way we're trying to bring in all the big corporations to abide by international regulations, UN recommendations, and bring in laws to make sure they do it, they pretend like mad that they want to do all these things. And the only thing you have to do is be in partnership with them and try and do it little by little by little. Well, I don't buy that. I think it's really important for governments to keep their policy setting free from commercial interests. And I'm sort of worrying with this new approach that we're going to lose that, because when it comes to setting standards, setting anything, there is so much that corporations can do to bully governments and bully you into thinking they won't give you those products unless you allow them to do X, Y, and Z. So much, sorry, there's so much to do, but don't forget early years. Don't forget breastfeeding. Don't forget, all the real foods, all those corporates that can package the things like you were saying, Hugh. You go, they can do that, and then they can pretend, and then they'll come in and do all the education in the schools. They will, and they'll sell you something that really is.
Okay.
If someone has helped us that.
Yeah.
Okay. I might throw some of these to you.
That's okay.
Perhaps the first one, actually, just the rhetoric around being in partnership with business. Does that automatically imply only voluntary measures, or is it possible to think about partnership involving regulation, as we've been talking about in this panel, but perhaps done in a sort of smart way that's actually informed by what is required? So what do you mean by in partnership with business? And
Well, look, without business, and we're not going to be able to implement our policies, and we've got to work with them to look at actually what does the evidence actually say that we can be doing things. I mean, business have been doing a lot in terms of, the labeling. I mean, it's impacted me. I look at all the labels, the red, the ambers. I read ingredients now. So I think it isn't about businesses holding us policymakers, forcing us to do the things that they only want to deliver and do. Actually, a mission-driven government is about saying, this is the kind of regulation we need. What are you able to do? And bringing that partnership approach and listening to them and looking at what's achievable, because actually we are all in it together. It matters. The public health is a responsibility that we all have, including industry. And that's why I think, manufacturers have got a real responsibility. I would love people to eat fresh food, right? But that isn't going to happen. It's more expensive. Food security is a big issue, not here, just in the United Kingdom, but it's across the global south. So, we've really got to think about how we promote people to think about, what it is that they are consuming and what they're buying. So processed food is a really big issue because we know that there are linkages to health outcomes. And so getting manufacturers to think about the ingredients that there are in products, and of course the shelf life, all of that sort of stuff, that's the kind of stuff that we should be talking about. We should be having those conversations. I want to see less things. Most people don't know what's contained in a lot of the food that they consume, and most people are reliant on actually putting stuff in the oven because it's just so easy and efficient, because they're working, right? They don't have the time to come home, cook a fresh meal, get their children involved. The 5-day initiative was really good, right? It was targeted at primary school. We've got to think about what a well-balanced diet looks like. Is it right to enforce people to have plant-based diets? I can tell you, certainly in my community, there's been a big conversation about the use of, certain products. Are they actually good for you? Are they better for you than eating meat, for example? And a lot of people will say, no, they're not. So look, communication and what people's perception is about going to vegetarian diets or eating corn. I mean, there's been some evidence around some of that. We've got to really be clear about actually what does a healthy diet look like. And, manufacturers also have a responsibility. Like I said, this is about a local and regional approach, about going into schools and giving, doing something and giving back to their communities, addressing those kind of public health outcomes. We know what the 5 killers are because of any region, because NHS England already produces that information. Question is, what is public health? What are manufacturers? What is everybody doing locally to have a strategy? Of course, without food strategy, we can't drill down. So there's a lot we can do in this space. Unfortunately, we don't have a government that doesn't believe in the state being active, as you know. And so it is going to be down to Labour. There are lots of stuff. I'm really excited about the brief in terms of actually the things that we should be delivering and we could be delivering to make a real difference.
just on sort of malnutrition and community based Meals on Wheels?
Look, malnutrition is the nutritional value of food is so important. And, you know, if you're consuming constantly processed food, is that nutritional? Is that good for you? What are the health benefits of eating that type of food? People don't have the information. You know, we've got social media. We should be using different ways of communicating why it's really important to have a nutritional, well-balanced diet. And even our schools, I talk to my daughter, what did you have for lunch today? It's pizza and wedges. You know, we've really got to rethink about what does healthy food look like? How do we introduce that to our young people? Because, of course, they will constantly get pop-up ads telling them to buy from Domino's and all these junk food places as well. So, yeah.
Okay, great. Thank you.
So on that level,
Sorry,
I've just saying the community Meals and Wheels, these people ain't getting Domino's, they ain't get no food at all. They're literally dying of malnutrition behind closed doors. And million pensioners in this country suffer from malnutrition. Yeah. So it's not a question of getting something from Domino's, it's a question of the community stepping up, the local authorities, and making sure these people have nutrition, like something to eat.
Absolutely.
Otherwise, it costs the NHS and social care 20 million a year.
And unfortunately, it's voluntary groups that are absolutely, you know, coming into this space and delivering, because, of course, public health grants have been cut to the bone by this government, and it's really, really difficult for local authorities to really lead on some of the things that they want to do as a result of that. So it's a great initiative.
Service, it's not easy for them. And it saved our country billions in healthcare costs, and also I've got my phone up with you later.
I'll talk to
Okay,
you.
good.
Yeah.
Thank you.
Sorry about that.
Lady there, and then lady back, and then gentleman there.
I'll stand up just so I can see you all. Nilani at Sainsbury's. I actually want to give a bit of context to the question, just to make the question a bit easier to understand. I'm often sitting on the other side of Sophie as part of her investor coalition. And I guess what I want to talk about is the importance of that ecosystem in driving industry change. So investors, by taking health seriously, it means that health is more at the forefront of people's minds at a C-suite level amongst the private sector. Investor benchmarks help to create healthy competition across retailers so that we can then see how we're doing, and we want to be better than our competitors. That plays an important role. Government policy has been really important in creating business risk, but also in setting the agenda and driving change where it levels the playing field. And then finally, NGOs can hold us all to account and make sure that we are all driving in the right way. But I think lately there's been a real lack of that health policy, and there's no getting away from that. And I guess, my question is, what do you each think is more important or most important in helping to retain that ecosystem? Because I think it is at risk, and it does play a really important part in driving sector change.
Okay, great, thank you.
Thank you for a really, really good debate. I'm Barbara Crowther from the Children's Food Campaign at Sustain, and one of the co-founders of the Recipe for Change campaign. We've got an event tomorrow, 10:30, which Nilani is speaking at, actually. So please do come along and carry on the debate with Daniel Zeichner as well. And I think we invited you, Preet, as well. So, but anyway, I'm not involved in the details, so I'm not trying to put you on the spot. So what we've modeled, recent modeling at the London School of Hygiene and Tropical Medicine has shown that if we did implement the National Food Strategy reformulation tax, that could potentially reduce 2 million cases of diet-related disease over 25 years, including 500,000 cases of cardiovascular disease, respiratory diseases, several types of cancer, diabetes, etc. What that would also do is it would create the incentive on the manufacturers that could sit alongside your targets for retailers. So how do you support the retailers to work with the manufacturers? How do we incentivize the manufacturers in a different way? And as the panel themselves have said, voluntary measures have utterly failed to do that. And what that would also do is it could raise money. And this government is going to need money to invest in, whether it's extending school fruit and vegetable schemes, improving the quality of our school meals, expanding the breakfast programs, subsidising fruit and veg vouchers, Healthy Start, you can name it. We could try, it is one of the few measures that isn't just going to cost, it's going to deliver. So I just wanted to say that. I also wanted to just kind of pick up on a point that Patty raised, which is how do we stop in any target-driven system, especially one like the Food Transparency Data Initiative, how do we stop it being gamified? because we've just seen Nestle launch its targets on healthier food, and it's a total increase in healthier sales of healthier food without any. It's not a proportion of their overall sales. It's they can grow their unhealthy sales at the same time. Secondly, they've included infant formula, water, and what was the other one? They've included also coffee. They've included sales of coffee as a healthy food, so they can gamify that own target. And so I think, how do we? And it's back to Patty's point, which is, yes, invite industry to the table, consult, listen, but ultimately do not allow industry to set your policy.
Great point. And then the gentleman here.
Not me again.
My voice isn't naturally as loud as yours, unfortunately. Peace of Abudu, Executive Director of Impact and Urban Health, and really fantastic debate. And it just feels like you've hit so many of the marks talking about regulation, new formulation, need for better food environments. There was one point that Preet raised, which hadn't particularly come up in the discussion until then, and it was about, yes, industry, yes, government, but also the role for communities. I just wanted to ask the panel, what role do they see for communities in tackling obesity, given the challenges we see when we look globally at countries that have actually managed to kind of turn back the tide of obesity? It feels like potentially a missing link.
Right, thank you. Let's go to the panel. So, the Investor Coalition. For those of us who are not in the investor world, do you mind just explaining what it is and how it works? And how does it actually have impact?
Yeah, so we were founded after the National Food Strategy came out because we really noticed there was investors just weren't engaging with policy on this issue. They are on climate change and other material risks that are facing investors. And so we set it up, and it initially started wanting to show investor support for the mandatory reporting recommendation that was in there. And we were quite surprised by how many investors quite quickly got on board with that. And those early letters were quite quickly kind of 20, plus names, signing onto them. And so we decided we don't want to waste this opportunity to have investors around the same table, being able to use our shared voice, because actually collectively we can have a lot more power than we can individually. So it started around that issue of mandatory reporting, but we're really excited about expanding that over time. And we've got, I think it's important to say, we haven't just got kind of sustainability focused investors around the table. We've got big institutional investors, the likes of LGIM, Aviva. So I think we can have some real traction, and it's great to see Impact for Urban Health in the room. They are one of our fellow advisors on the coalition. If I may, while I've got the mic, I mean, just to talk about this point that Nalani made, I think it's really important. And I think, I'd like to say that the other groups without well-designed regulation can get us there, but actually I don't think they can. And so I think that's why we're all here, right? I think it's so important that we have well-designed regulation in this area. I would say it is rising up the investor agenda. And, in the last 2 years, we've seen the first health shareholder resolutions, which I think is a really interesting marker. And since that first one at Tesco, which many of you might have read about, but it's since been followed at the likes of Unilever, Coca-Cola, PepsiCo, Kellogg, various others. So that's really good, but I don't think it's going to kind of get us there. And the consumer kind of angle as well, I think, I don't know who, I'm glad it's an opportunity to mention this, but the Farm and Countryside Commission came out with some really interesting research a couple of weeks ago to say that 78% of people want more ambition from government on this issue, and only 3% think that they're already doing enough. So, yes, those other stakeholder groups, it's rising up the agenda, but I think well-designed regulation is absolutely key.
Great. We're going to have to go wrap this up. So I'm going to ask for sort of final comments from folk. So, one, there's two things I want to bring you in on. One is this balance between tax versus regulation. So from first principles, taxes on sugar and salt seem to make tons of sense. That will drive the kind of behaviour we want. We know that's going to be difficult because of politically, given the cost of living concern. It really reminds me of the sort of climate change debate where everybody 20 years ago said what you need is a carbon tax. How we've made most progress is actually through regulation. So I'm interested, pretty particularly, do you see that? Do you see us making more progress through regulation than tax? And then the other question, I think, is about the role of community. So perhaps everyone can pick that up in a final set of comments. Pretty much start with you.
I think so. I think, look, you talked about lots of stuff already done around food strategy. We've got to implement and put these recommendations in place. And so regulation is definitely the first steps that we've got to look at. We've got to work with industry. And I take on board the issues that you have all raised. But we've got to do more around prevention and behaviour change and demand from consumers. Look, I would love to see a Whole Foods kind of market. They exist, but they're so expensive, right? So this is fresh food that you can purchase. You can have lots of fresh, produce, for example, and actually that just shifts people's mindset in terms of actually the things that they want to buy and purchase, and how they want to live their lives much differently and actually cook. And, in our schools, we don't have those kind of programs that enable young people to take up cooking lessons and want to participate. But actually, those are the kind of things, they seem so simple and basic, but actually they make a difference. I'm trying to encourage my children to actually cook a meal one day a week and say, no, it shouldn't have to always be me. And and obviously they don't like that. But I think there's a lot we can learn actually from communities, because look, some of the basics of cooking. So when I cook an Italian meal, I use the basics of like onion, garlic, ginger, turmeric. We know these are really good things to build a sauce base from. It isn't rocket science, and it doesn't have to take a lot of time. You don't need to spend a lot of money to purchase these products, but actually using these kind of basic ingredients, learning from communities actually to some of the health benefits, and also recognizing actually communities use probably too much fat and butter and things like that, and how we educate them, because we know what prevalent diseases that they have, so we've got to really be much more targeted. But I do think this is about prevention. I think it's about getting our country more physically active. Of course, if you're not expanding energy that you're consuming, then of course you're going to have an obesity issue, right? So, but there is a lot to do in this space, and I think I'm heartened by manufacturers and retailers who want to do more and want to give back to their communities, because I think that really makes a difference. What is it that you can show that you are able to do collectively with us all? Thanks.
Thank you, Hugo. Do you want to pick up the point about gaming? Can you game these targets, or is it very easy to set a sort of?
Yeah, I'd love to. So this, can get right into the data. Yeah. So we need to. Government should set an outcome to achieve, and then work with industry to achieve it. So you don't lower the ambition, but then you work in terms of what's actually possible. What we've been talking about here, these mandatory targets, we've suggested using something called the nutrient profile model that already exists in UK regulation. It's a metric that already exists. And you can say, well, maybe it's not perfect. Maybe there's 78 different ones internationally. But the problem is people can argue around it for 5 years and not do anything. So it's pretty good. So we can use this, and it's importantly, it's a continuous outcome variable. So what I mean by that is something isn't either good or bad. And so that makes it much harder to game, because you have an incentive across the distribution of foods. So it's slightly more technical, but we've got the data to do it now. Or at least that data exists within industry, and mandatory reporting of that data would allow you to set a detailed regulation that would not be easily gameable. Briefly on the communities angle. Now, so my background is behavioral science. That's sort of where I come from. And education policies only work in environments that are conducive to allowing the opportunity for that behavior. So bringing the public with you is incredibly important. And we see they want this sort of stuff. But just stopping short of telling people or even teaching people, here's a cooking class or here's a sort of, some more information, that's not going to work on its own. So it's about getting into these communities and encouraging people to allow politicians or industry to move further to create that healthy environment that allows them to make good on the already existing intentions to eat healthier. It's no good just telling people to do something whilst making it really difficult for them. So that's slight nuance on some of the education stuff, where it's necessary but not sufficient.
Chris,
just go back to what I said at the start of the debate. Really, at Asda, we take our responsibility to help customers, communities, colleagues, make healthier choices. Of course, we do. So, that's why we're here today. It's why we've got the partnership. It's why we're here, standing ready to make the necessary changes on this incredibly important topic.
Great, thank you. Hermione?
Just pick up on the communities point quickly. I think that absolutely there is a role for communities. I think Henry Dimbleby has made a point, I think, in the National Food Strategy that so quite a lot of change in school foods has come down to like parents or an individual or someone that really cares. I think that that's great and that's important, but it's not an excuse. You know, we can't rely on that over other, you know, potentially difficult interventions or choices we have to make. I think one other final point, you I think mentioned this classic and a frustrating line that's sometimes used by politicians, that we don't want to tell people what to eat. I think there's a lot of work to do in massively shifting the narrative on this, because actually we're talking about a really positive thing. We're talking about the ability to make people more healthy and have better life choices. And people want more action. And I think we need to do a lot of work in kind of shifting the narrative away from that, which is often promoted by the media and some politicians, but it is not how we should be framing it.
Yeah, so I think my final point would be the mandatory reporting piece. You know, only 20% of retailers are currently reporting the percentage of their product portfolio that's healthy, aligned to a government-endorsed nutrient profiling model. And so we've got a long way to go. And I think that mandatory reporting feeds into the great policy work that the proposal that Nesta have got on the table. But absolutely agree with Miney, there is no silver bullet. So it's about that plus. But there's some really exciting kind of pieces of the work that are on the table. It's just about getting working on them now and implementing them.
Great. Well, thank you very much to all the panelists for a really, really good discussion. Thank you to you for all your questions. I just want to say thank you on behalf of both TBI and Nesta for today. Nesta's mission on a healthy life is focused on halving obesity. And that's, I believe that's entirely possible, partly for some of the comments that we've just been mentioning. It's a smaller issue. It's a smaller problem than you might think. So around 200 calories we can reduce that from the diet over a 5 to 6 year period without people necessarily noticing and making very conscious decisions, if we put in place the right incentives and regulations around the whole food system. What we're doing to try and make it happen is a combination of practical partnerships with the likes of Viability, which we're really, really pleased to be able to do, to show what can happen practically on the ground to make this a reality, plus putting forward regulations and policy changes that we've been discussing, as well as also working on new ventures and new ways of tackling this. Not quite the whole foods that's affordable, sadly, but one example is a healthy vending machine that we've just a business that we've just been trying to build out. So a combination of practical partnerships, policy, and some ventures. And we, as I said, really believe that by 2030, this is something that Labour could commit to and achieve, and could have amazing benefits for society and for the NHS. Thank you very much, everybody, and thanks for coming.